This is the Mazima podcast. Hello, and welcome to the Mazima podcast from the African Institute for Investigative Journalism. My name is Daniel Lutaya. Today we'll be talking about COVID-19. It is an issue that has been all but shelved from most of public light. We've had reports upon reports that have seen this light of day. We've read them. We've analyzed them. Parliament has seen them. Various stakeholders have seen these reports. But these reports right now remain shelved somewhere in a government shelf somewhere. And very little or no action is being seen to be done. And the person in the studio with me is one that has actually gone to the length of reviewing these files and looking at the analysis from official accounts of government auditors on what exactly went on with COVID-19 funds. Lots of money spent. I think by the last time I checked, the Auditor General's report showed about 3.3 trillion shillings that had been spent in the 2020-2021 national budget. It's about 7% of the whole budget spent on COVID-19. Hi, Rahim. How are you doing?
Good, thank you. How are you doing?
What did you find out from your investigations, and what prompted you to get into these, maybe what we would call cold files?
So at the peak of the COVID-19 pandemic, President Museveni announced total lockdown, and so many events started unfolding before our eyes, among which are the famous quarantine centers. And these were places where people who are feared to be COVID-19 positive or even had symptoms were kept for 14 days. Now, accountability questions have been raised on how government spent money during this time. Now, to date, some of them have never been answered. The Auditor General, John Muwanga, raised various audit queries, some of which, up to date, have never been answered. Now, this follows a supplementary budget that government, through Parliament, requested for, about 4.3 billion. To cater for meals for people in quarantine centers. So the Ministry of Health contracted a company called Keba Investments Limited to supply food to all quarantine centers from Arua to far and wide in Arua, in Entebbe, in Jinja, in some parts of Kasese, and some places in Gulu. The Ministry of Health, through a contractual framework, agreed with Keba that food would be supplied at 5,000 for breakfast, 10,000 for lunch, and 10,000 for dinner, which gives you a total of 25,000, quite understandable. Now, the contractor provided food for quarantined people, health workers at Entebbe Regional Referral Hospital, the Ministry of Health Call Center, Fisheries Training Institute, among others. So it is very important to note that Keba was the only company contracted to supply food to all these centers across the country. Dan, I know you're trying to imagine how that is even possible.
That is for the entire four corners of Uganda.
Four corners of Uganda.
And the islands too, just in case you're wondering.
Now, the unit cost of food in these places varied greatly. For example, in Arua, meals for COVID-19 patients went as far as 62,000 shillings. Now, remember, they signed 25,000. Mm-hmm. But now, this company is supplying food at 62,000 shillings. And that is Arua. And that is about 37,000 extra from what was agreed upon in the contractual framework. Some places in Jinja, food went to as low as 15,000 from the 25,000. And while this company provided food at Entebbe Regional Referral Hospital and some selected centers at 45,000 shillings.
In Entebbe.
In Entebbe. Now, it was also established that MS Keba supplied breakfast, lunch, and dinner at a cost of 105,000 per person per day at the Grand Global Hotel. Let me say that again, Dan. 105,000 shillings per person per day.
That's crazy. It's
crazy, man.
It's I don't know. Man, I've had plates of food at 100,000. They are not at referral hospital. They are not in.
Lucky enough, you're one of the people who are there.
Yeah, I ate that food. I do not think that food was worth 100,000. It wasn't worth 40,000, and that's just me thinking because I live in Kampala. I eat food every day. I buy food every day. So 40,000, no. 20,000 a plate, no. Still. Maybe 10,000 a plate. That's
and that's the high end.
Yeah.
Now remember, this is a pandemic, and we are trying to see.
And this was a time during COVID-19 where the food prices had actually gone down. If you remember,
suppliers had food,
because there was a lot of supply, especially matoke.
Yeah.
There was a lot of matoke. There was a time a tray of eggs had gone down to 6,000.
Yeah, 6,000.
So during COVID-19, food prices actually went down. The only problem was people did not have the money to actually buy. Most of the people in Kampala didn't have the money to actually purchase the food, even at its lowest prices. So, if anything, the price of food procured by government of Uganda should have been way lower than the price pre-COVID, or the normal price, as you want to call it. So, it's highly irregular, and I think these are things that are clear. They are written in black and white. These are government reports. I think that you relied on to do this investigation. So I honestly, for me as a patient who had COVID-19 for 14 days, I cannot believe that I ate food that costs that much.
All right. So on average, Mr. Lutaya, let's say that 40,000 for lunch, 40,000 shillings for dinner, 25,000 for breakfast. If you look at that price, that you're having breakfast at 25,000, lunch at 40. Now, my Hajat, where I eat from, here in Kampala, I eat food at 5,000. Lunch, 5,000 dinner. Breakfast, sometimes 2,000 or 3,000. Now, this food was supplied on silver plates. It's not like it was, buffet or something. No normal food at 105,000. And so one of the questions was, why is one company supplying food through all these places and at a price that was not agreed upon, but this person still gets paid? You sign 25,000, 105,000, but you still get paid. By 25th of June 2020, the contractor had made invoices for food of Uganda shillings 3.3 billion, at least according to the Auditor General's report. 3.3 billion shillings.
Yeah, big money, and big money. I think there is, if the investigations were done even by a government agency, there is need for the government to take this COVID-19 money a little bit more serious, I think, if you ask me. There is need to take it a little bit more serious because these were public funds. These were public funds. And even though that money that was not from the consolidated fund, that was not from the government coffers, was borrowed, it was borrowed in the name of the people of Uganda. So the people of Uganda will still have to pay those loans, and therefore there is need to query and either acquit or commit those that could have misappropriated these funds, if indeed the funds were misappropriated.
People have been here long enough, have a saying that Ugandans love to let things go. We have since moved on. These reports are released at least every year, and you know what happens? We just shelve them and just move on to the next thing. And I think that it is the duty of investigative journalism to, bring accountability questions on table and hold these people to account and look for answers to many of these questions that perhaps may never be answered.
Well, these are questions that we really need government to look at and investigate. And I think the problem with this country, and I don't know if Rahim will agree with me, is that there's very little. Of course, there is a lot of due process when it comes to the investigations and auditing and reports. We have various reports, very many reports. But then the problem is that what happens after the reports? Where is the action being done? Because I think the Ministry of Health, the Ministry of Finance, and the Parliament actually owes it to Ugandans to give answers as to where or how this money was spent. Because if there is an explanation that has been verified and accepted by maybe a Public Accounts Committee of Parliament, then it's easier for us as citizens to sit back and say maybe it was an emergency procurement and maybe some things happened in there, but it's very, and it's, I think maybe one of the other things that we have to query is how one company was contracted to supply food to Arua
from Entebbe
to Kampala.
Exactly.
I do not know if there is a company in Uganda that can pull off such a job unless they have choppers, because it's practically impossible for you to deliver food, or maybe to cook food and deliver it to all the corners of Uganda, because I think all the regional referral hospitals were actually having COVID-19 patients and they were all eating, and it's highly unlikely that the same company could supply the food up in Arua, down in Mbarara, all the way to Iganga, same company. I think there must have been there must be some questions that we need to be answered, right?
Yeah, and we took a deep dive into that same company. But even before we go to the company, let's break it down, Dan. That time, during the first wave, is when President Museveni came out to say that there are so many false positives that were being admitted. Now, when you look at the numbers, that time, numbers were going like really, really so high. And the graph was striking so high. And he said that close to 679 confirmed cases were classified as false positives at Makere. Now, that, I think, explains why after when government came out to say that, you know what, you guys, you can now have home-based treatment, the numbers went low. Could there be people who are profiteering from the pandemic? Critical question.
Yeah, it's a very critical question. I don't think that's a question even I can answer. I think that's a question that actually the Parliament needs to answer. And people, and the Office of the Inspector General of Government, these are offices that have resources, manpower, to investigate these things. Because if there are 600 false positives, that means 600 more people were eating this food that was already being given to government of Uganda at a very, very exorbitant rate. I think there is a very big gray area there that we really need to invoke government to explain. And I do not know if one of the I believe that there are many government people that are listening, and I think if they are listening, as I think they are, then they should actually do something about the people, the money that was spent on food. Something as small as food. How much? You said how much in billions was invoiced
about
by MS
3.3 billion.
3.3. Now that's a lot of.
But the contract said 4.3 billion.
Yeah, that is really a lot of money. It is indeed a lot of money. Did you ever find out who the directors of this company are?
Yes. Now, according to the documents that the AIIG unveils team got about MS Kaba, it shows that this company was registered on 22nd day of August 2005, and it deals so much in food and restaurant, caters, hotel, holiday camp, resort, among others. And the signatories to this company are Amos Nahawe and his wife, Fiona Nahawe. So, we have also found out that the same company supplies food at the Ministry of Health and started when the Permanent Secretary, Diana Atwine, had been chosen to be the Permanent Secretary of the Ministry of Health. So whilst our investigation cannot pin Diana Atwine to this company, but we can't hide away from the fact that they also joined the ministry same year that she joined.
Well, many questions. This company, I'm looking at documents here. This MS Keba Investments Limited was incorporated on the 22nd of August 2005. And it's registered, of course, duly registered. I've seen stamps from the Uganda Registration Services Bureau. It is a catering and training services, bakers, confectioners, grain milling, manufacturing. They make Success and Dominion bread and cakes, and sellers of bread, milk, cheese, table delicacies, vegetables and fruits, and general provisions. I think the investigation here, and I think the same thing that the Ministry of Finance and Auditor General were investigating, is not whether this company is involved in food and whether this company actually can supply food to the government of Uganda. I think the investigation was the irregularity in the amounts of that the government was paying for food. And I think I remember that still during the COVID-19 pandemic, there was an issue to do with the price of beans that government was procuring, price of beans and posho, which was being given to people, and the State House anti-corruption unit under Edith Nakalema, Colonel Edith Nakalema by then, actually stepped in and arrested the permanent secretary of the Office of the Prime Minister, which was doing that procurement. I think such things need to happen, because people should not overcharge government thinking that it is just government. Government is actually, the money that the government of Uganda is using to do all of these procurements is actually owned by Ugandans, and therefore there is need for this money for frugality. Frugality is important when it comes to handling public funds, because whereas some people actually call them public funds, for me, I like, some people call them government money. It's not government money, it's public money. It is owned by every Ugandan. It's owned by Daniel Lutaya here, sitting in front of a microphone. It's also owned by that Boda man who got me to this studio. So we need to public servants and people in offices where they are signing off this public money need to, I think, have that at the back of their minds. But also the gatemen that have been put by the law, like the Inspectorate of Government, like the Parliamentary Accounts Committees, even the entire Parliament of Uganda needs to look into these documents. And I think this is why journalism is referred to as the fourth estate, where the three estates have failed to account or to call to book those that are responsible. The fourth estate needs to come in and put these things in the public domain so that the public pressure can actually move government. I've seen the power of journalism, investigative journalism, and I've seen it in action in various countries, and I think even in Uganda it has actually done wonders. So it is important for us journalists, and I think I'm elated that the African Institute for Investigative Journalism has actually come out to bring back this information into the public domain, so that the public can have a discussion around this money, which is their money, the public's money, have a discussion around it, and then push the people that are mandated and given the task of investigating and acting to actually act. Because at the end of the day, if this money was borrowed, this money was, I think, the COVID-19
most of these monies were loans. Actually,
if this money was borrowed, then the people of Uganda are going to start paying very soon.
paying
So
for
if anybody needs to bring back, if they took any of that money, that would go a long way in helping the people of Uganda pay off this loan easily. That's what I think.
Absolutely, I can't agree with you more, because at the end of the day, it comes back to you. And like you said, it is the duty of us at the African Institute for Investigative Journalism to open these cold files and hold people to account and answer to these questions. And this explains why we had so many numbers at the beginning of the pandemic. At least when we still had quarantine centers running, I remember the president coming out to say that some of these people, about 679 of these, were false positives, people that were regarded as positive yet negative. And then after we went into home care, and these numbers started dropping down. And this no wonder explains how people are profiteering from the pandemic through so many things. And in this investigation, we're particularly looking at food, but I know that the Auditor General's report speaks to so many, procurement of hospital utensils, hospital machinery, tents, and among others. And so we also looked into MS Keba, this company that was contracted by the ministry to supply food to all these quarantine centers. And we realized and found out that it is the same company that is supplying food at the Ministry of Health headquarters in Wandegea. And it's the same company. So MS Keba is a company registered and dealing in food, registered and incorporated on the 22nd day of August 2005. And its signatories are Amos Nahawe and Fiona Nahawe. So this couple owns MS Keba. It is also important to note that MS Keba started its service with the Ministry of Health the same year that Dr. Diana Atwine, the Permanent Secretary of the Ministry of Health, started operations in office.
Wow. A lot of information here from the investigative journalist Rahim Nwali. He brought lots of documents to studio to show. He brought the registration certificates, memorandums of articles of associations from the Uganda Registration Services Bureau about this company. He also brought the entire report of the Ministry of Finance on COVID-19. And I think this is data journalism as at its best, getting the documents, combing through them and finding irregularities and putting them in the public eye. I think that's great. And I think that is exactly what this country needed as we get out of the COVID-19 pandemic. Well, the COVID-19 is still here, but then it looks like the accountability questions had been shelved. But now that we have opened these cold files, there will certainly be some action, and we'll be following up also on social media at the African Institute for Investigative Journalism on both Twitter and Facebook. If you're listening to this, you can go there and join in on this discussion. There'll also be very soon people will be talking about this, we are sure. Members of parliament, activists, and even people in power, ministers in cabinet, should be speaking about these issues and ensuring that money that belongs to Ugandans has been fully accounted for. And I think I am proud to say that I am one of the people who has seen the start or the spark that's going to ignite this new fire of seeking accountability for the COVID-19 funds again, before Ugandans forget that there was money spent in 2020 to 2021.
Absolutely.
All right. Thank you very much. That is Mazima podcast for today. And you can also go to our YouTube channel at African Institute for Investigative Journalism. There's lots of content there, investigative content, if you are interested, but also continue listening to this podcast. We'll be bringing various guests, various investigative journalists to talk about matters that affect the common person, but also unearthing facts, bitter facts that will help this country move forward. Remember, this country and the whole of Africa needs journalism that is not only informative, but journalism that gets the facts right and that gets these facts and puts them in the public domain. My name is Daniel Lutaya. Bye-bye. This is the Mazima Podcast.